Hi, good afternoon. I'm Dr. Damian Wong from the Island Hospital. I'm a gastroenterologist and a hepatologist and have been practicing for almost 40 years. I started my career at the University Hospital in Kuala Lumpur and have since moved to Island Hospital about 8 years ago. I'd like to share with you my passion in two topics, which I'm going to discuss with you or share with you this afternoon. And that will be on Helicobacter pylori infection as well as cancer of the stomach. I'm not an oncologist and neither am I a surgeon, so we will not discuss in detail the surgical aspects as well as the chemotherapeutic aspects of the infection. But I'd like to share with you the infection of Helicobacter pylori as well as cancer of the stomach. We will go through the topic first on the H. pylori infection and then to the cancer of the stomach. Now, H. pylori infection was reported in the Lancet in 1983, but actually the infection had been there for many, many years before that. Is that just that the people do not understand and was not able to correlate the infection with gastric diseases. So H. pylori was discovered in 1983 and was found to be related to a number of gastric conditions. We have now since know a lot more about this infection. In fact, when I was at the University Hospital in 1984, we started to look at this infection after it was reported in 1983. And one of my colleagues, Professor Goh, did an MD thesis on H. pylori infection in Malaysia, and the University of Malaysia University Hospital is now one of the center for H. pylori infection. Now, this is a little bacteria, gram-negative, and has a helical pattern, and therefore that's why they call it Helicobacter pylori. Now, this picture shows the little bacteria in the crypts or in the spaces in the stomach itself. This is a pathological picture of it. And you can see the geographical distribution. It is worldwide, but certain areas in the world have a higher prevalence. It is very prevalent in Russia, Brazil, and is found in Chile, Argentina, as well as definitely in China, Japan, Korea, and ASEAN countries. Locally in Malaysia, there were some studies done by the University of Malaya at that time, and the things have changed actually. Earlier on, we have a prevalence of about 51%, and recently over the years, the prevalence have decreased. And so has actually cancer of the stomach. The trends in cancer of the stomach have shown the decrease. I will show that a bit later. Now, what are the results of infection with H. pylori bacteria? Well, sometimes it doesn't cause problems, but most of the time it causes what we call it inflammation in the stomach, what we call a gastritis. But 15% of persons who are infected with H. pylori will have ulcers. This occurs in younger patients usually, and about 5% lifetime risk of stomach cancer. And that's why this bacteria has become a newspaper topic. You'll find that you will read the media, you will find a lot of the pharmaceutical companies as well in media talks about H. pylori and gastric cancer. But I want you to have a perspective of this is only 5% lifetime risk, which means that out of 100% with this H. pylori infection, maybe 5% will have cancer of the stomach when they grow old. Now, let's look, and this picture shows you an endoscopic picture that we do when we do a scope. They put a tube into the stomach and look, and this shows a picture of inflammation, in fact, the various changes of inflammation to even a little bit of thinning of the stomach itself, which will cause an increased risk of cancer of the stomach. Now, this is the classical picture. When we see this, when I see this picture in the stomach, we know even without doing any further tests, this patient actually have H. pylori infection, and we can diagnose it by taking a tissue out of this stomach mucosa and examining it. Now, this is a bigger picture, NBI, what we call a magnification picture of the same thing, and it shows you a pattern which we recognize, and of course, it looks a little bit frightening to you. Now, H. pylori infection, as I said, 15% of them will cause erosion and ulcers. And these are ulcers in the stomach, and these are ulcers in the duodenum. Now, as I've mentioned, 15% of persons with H. pylori infection will get ulcers at the duodenum or stomach. But if you have a patient with gastric symptoms and who have an ulcers, and we look for H. pylori in this group of patients, 90% of patients with duodenal ulcers will have this bacteria. And 80% of patients with gastric ulcers will have this bacteria. So therefore, most of the ulcers in the young people will be due to this bacteria. However, you must remember there are other causes of ulcers. And that in the older persons, people tend to be on drugs that can cause ulceration. And in this group of patients, it's the drugs that may be responsible for the ulcers. Drugs like aspirin, where patients use for heart protection, and then the others are the what we call painkillers for people with joint problems. So the old people tend to have both, and they tend to take sometimes both these medications. And if they have H. pylori, the risk of getting an ulcer is even higher, and they may have complications of bleeding as well. So now, how is H. pylori infection diagnosed? But before that, I missed a slide, and I want to tell you how H. pylori gets infected. Not very well known actually, but it is due to oral route or fecal oral route. What do you mean by fecal oral route? Basically, what happened is that contaminated materials, for example, in Chile, they have found that the well water in those days were contaminated with this infection because of the mixing of stool to the water that goes into the wells, and therefore what happened is that they get infected that way. The other one is when the contents of the stomachs go into the mouth and goes to the food, and therefore they will get infection. So it's an oral infection or a fecal oral infection. Now, how is the infection diagnosed? There are no symptoms. Although some people list their symptoms, there are no symptoms for H. pylori infection. H. pylori infection does not cause any symptoms. H. pylori infection causes certain changes in the stomach that might give rise to symptoms. For example, if you have ulcers, then you have ulcer symptoms. Gastric pain with food, epigastric pain with hunger, these are the symptoms of ulcer. Now, on the other hand, there are also a lot of patients who have this infection without any symptoms at all. And I'm sure you will know of someone, or you might yourself have been diagnosed to have this infection because of a blood test, not because you have any symptoms, just you have any gastric problem. So therefore, you may not have symptoms at all with this infection, but you have the ulcers, you will have symptoms of ulcers. If you've got indigestion problems, you will have symptoms of indigestion problem. Now, how do we then diagnose the infection? There are three ways, or more than that, but the three common ones are the blood tests. Now, the blood test tests for antibodies, which means exposure to the infection and an infection that has been have taken place, and the patient have developed antibodies. This is good for the first-time testing, but it is not good to test with the blood test if the patient has been treated before, because these antibodies will stay in the blood almost forever. So therefore, it is not a test for healing, or it is not a test for eradication. The test that we do for eradication will be a breath test. So you can do a breath test for looking at this bacteria, and you will know that if the bacteria is in the stomach, it will cause changes in the breath test, which is available in most of the labs. Now, most of the time when we do a scope for patients who come in with indigestion or with symptoms of ulcers, we'll be doing a scope. And when we do a scope, we will take some tissue out from the stomach and examine it either through microscopy or to do a special test of the urease, which will test whether the infection is there. So this is an endoscopic test of the H. pylori infection. That's how we will do and how we will diagnose an infection. A simple test with a blood test. You can do a stool test as well, which is, I think, currently not available in most places. There may be some available in some centers in Kuala Lumpur. I'm not too sure about that, but this is also a very good test. This test also tests current infection. Breath test, stool test, and endoscopic test, current infection. The blood test sometimes gives you current infection, but it is also present in all infection. Even if the patient have it been treated and eradicated, the blood test may still be positive. So what is the outcome of this infection? I have mentioned it causes inflammation in the stomach, and these changes will go on to atrophic gastritis, maybe intestinal metaplasia, and then later on cause gastric cancer. A lot of patients with indigestion may have the infection, but it cannot be said that this infection causes indigestion because there are a lot of patients with indigestion do not have this bacteria. The only way you can prove that this bacteria is the cause of indigestion or gastritis is when you treat the patient and the patient's bacteria is eradicated or actually removed, and that patient improves in the symptoms of indigestion, not for a short while. If for a short while, it could be due to the antibiotics or due to the medication, but for a longer period, usually for a year. That means you get rid of the bacteria, you do not get indigestion alone, and you can say that the indigestion is due to the bacteria. Of course, ulcers you can treat. If you have ulcers and you treat the H. pylori infection, you cure the ulcers. That's why in the olden days, let's say 30-40 years ago, when you have ulcers, people say you cannot cure the ulcers, you can make the ulcers heal and it comes back again. But now we know if the ulcers are due to H. pylori infection, you get rid of the H. pylori infection, you will not get ulcers again. Mind you, the difference between ulcers and indigestion is totally different. You can still get indigestion because that may not be due to ulcers. In fact, ulcers are now very easy to treat if it's due to H. pylori infection. Now come to the next part, which is the stomach cancer. Now, stomach cancer obviously occurs in the stomach, and this is a picture by a scope of a patient with an established ulcer cancer, and it looks different from a simple ulcer. Now, what are the trends in stomach cancer? Stomach cancer used to be one of the most important cancer in the world, but it has now become less and less common. In fact, the fifth common cancer has now become most likely the seventh most common cancer, probably in the United States and the rest of the world, but it's still the third leading cause of cancer death. That is because cancer of the stomach is quite a fatal disease because it is detected late. Now, this cancer is also actually occurs most in East Asia, mainly China, Taiwan, Hong Kong, Japan, Korea will actually account for 60% of the total world cancer of the stomach. The rest that have the other countries that have cancer of the stomach quite commonly will be in South America, basically in Chile and some of these countries, which also have a high prevalence of H. pylori infection, and therefore they also have a high prevalence of gastric cancer. Now, the important part of this part is that H. pylori infection is related to 70 to 80% of all the stomach cancers. There are other reasons for it. What are the reasons for why the cancers of the stomach is going down? The reason is very simple. Even before the treatment of H. pylori, you will have increased the invention of the refrigerator helps a lot, because we can now have fresh fruits and vegetables we can put in the fridge, and therefore the availability of fresh fruits and vegetables help in the reduction of stomach cancer. There is a decreased reliance on salted and preserved food, which is a cause of cancer of the stomach. And of course, reduction of H. pylori infection, not due to treatment, but to public health measures. And I'm sure you now realize why public health measures, especially when we're talking about COVID. We don't have very specific medication. The medication is not foolproof, but public health measures like mask wearing and social distancing help to reduce infection. So is H. pylori. The public health and improve water supplies, improve hygiene of food, and therefore H. pylori infection has been reduced even before the use of antibiotics to eradicate it. Now, stomach cancer is not entirely due to H. pylori alone. There are other risk factors. The risk factor would be, I would think that I would put race there as such as well, because it is common in certain race, especially the East Asian, the Chinese. H. pylori infection is quite common in Indians, but gastric cancer of the stomach in Indians is low. That is also in Malaysia as well. Smoking is not a good, it is a bad factor, therefore it increases the risk. People who are obese, especially also obese with diabetes, also increase the risk of gastric cancer. Of course, some people have family history. That gives rise to a slightly different type of cancer, which is a diffuse gastric cancer, where the genetics are due to abnormality or mutations of certain genes, which is important. However, a family history in other situations is also important. Now, this one, I may want to come back to it later, but at the moment, what I'm trying to emphasize again, 60 to 70% of gastric cancer is due to H. pylori infection. And now we have since for the last few years, have shown that if you are able to eradicate the H. pylori, you are able to reduce the cancer incidence in that area. And that has been shown by two major studies, one by Taiwan in the Matsu Island and another one in China in Shandong, where their intervention after 15 years, they look back at it, when they eradicate the H. pylori infection, the prevalence or incidence of stomach cancer has reduced. So we have proven that we can actually reduce stomach cancer and we can intervene by removing the H. pylori infection. Now, this shows you a picture, or again, a scope picture of a cancer, ulcer, and of course, a various obvious ugly-looking cancer of the stomach. Now, what are the symptoms? Let me put it straight to you again. Early stomach cancer has no symptoms. There are no symptoms with early stomach cancer. When you have symptoms, it is established stomach cancer, and sometimes some of the symptoms or signs suggest late cancer. So tiredness, weakness, anemia means bleeding. And bleeding means the stomach has an ulcer or has a cancer that is bleeding. Abdominal swelling, again, a late manifestation. Jaundice, a late manifestation. A lot of people come with epigastric discomfort, indigestion. The indigestion may not be due to stomach cancer, it may be due to just indigestive diseases, but because of workup at it, they may at that time be discovered to have cancer. Loss of appetite, nausea, vomiting obviously are symptoms of cancers, but again, these actually are symptoms of established cancer. So therefore, if you want to diagnose cancer of the stomach early and there are no symptoms, it can be only diagnosed by screening. If I have time, I will talk a little bit about that. Now, patients who are anemic for no reason. For young females, if anemic, sometimes it's due to period loss. But in a man and in older females, if you have iron deficiency, anemia, and you are eating enough food, that means there must be some loss of blood in the gastrointestinal tract. It could be due to other diseases. It could be due to ulcers and erosion and not necessarily cancer. But when we investigate patients with iron deficiency anemia, a number of them will have cancer, and colon cancer, in fact, forms the larger portion. So how do you diagnose stomach cancer? History, physical examination is the pathway for all doctors. We want to ask the history. We want to examine the patient. As I have mentioned, we do not want to find anything on physical examination, because if we find anything on physical examination, the patient has come in late. And maybe sometimes we cannot do a lot to this patient to improve his health. There are studies, you can do x-ray studies if you're in a place where you cannot do endoscopy. But the most important tool for the diagnosis of stomach, since it's a stomach, is to look inside the stomach, where you can take a tissue diagnosis. And that is endoscopy. And that's the pictures that I've shown you are endoscopy. Now, if you suspect that the cancer has gone out of the stomach, then you can add to it certain other investigations like CT scan or MRI scan. And of course, doing it, we are trying to hopefully to find a normal CT scan, a normal MRI scan, so that the patient do not have a severe disease. Why is that important? If you look at this, the 5-year survival rate of established cancer is only 32%. And if it's a stage 4, that means you have spread outside, it is 4%. But you have early gastric cancer, there is a 86% 5-year survival rate, which means that if you can diagnose the cancer early, we actually make a lot of difference to the survival of this patient. Now, management of the cancer, in established cancer or known cancer or established cancer, if you can do surgery, surgery is curative. The type of surgery will depend on where the cancer is. If it's in the distal part or the lower end of the stomach, you can do a subtotal gastrectomy. But if it's the proximal part of the stomach, you may need to do a total gastrectomy to remove the whole stomach and refashion or redirect the whole gastrointestinal tract. You may or may not, or the oncologist may or may not want to do chemotherapy before surgery or do it after surgery, depending on the stage of the disease. I won't go into the detail of that. Radiotherapy can be used. And of course, if the patient is very old, with a lot of other comorbid medical condition, and is not fit for any surgery, for any treatment, the patient is still cared for. Even untreated cancer can be cared for. We can make the patient feel better and live better. How to improve? As I mentioned before, if you are diagnosed with late cancer, it's not good. The outcome is not good. So can we prevent, or can we do an early diagnosis? We can prevent cancer in some ways. First of all, there are certain risk factors. Food is one. Salted food, pickled food, preserved food is bad for the stomach and increased risk of cancer. So cut down on those items. Fresh vegetables, fresh fruits reduce the risk of gastric cancer. And you eat more of that, you reduce that. And of course, look for H. pylori infection. If you can get rid of H. pylori infection early, then your risk of getting cancer is reduced. And that you can prevent the gastric cancer. Mind you, you have to do it early. Because if you have the H. pylori infection and you come at the age of 70 and you have H. pylori, even if we get rid of the H. pylori at 70 years old, your risk of cancer may not be reduced, because most of this H. pylori infection occur at childhood, and therefore you may have the H. pylori infection for 50 years, and therefore the changes in the stomach may have reached a point of no return. We call it a point of no return, and therefore the risk of cancer will still be there even if the H. pylori infection is gone. Now, if you cannot prevent it, then early diagnosis. Early diagnosis means, as I mentioned, no symptoms, it means screening. I'll give you a picture. So H. pylori eradication, as I mentioned, can cure ulcers. It reduces the lifetime risk of gastric cancer, and of course, it also improves some patients with indigestion. I won't go into detail of the treatment. Usually involve a proton pump inhibitor, which is an acid-reducing agent, and 2 antibiotics, and there are different medications that are used for that as well. I just want to end by pointing out that for early diagnosis, if you suspect or you reach an age where you have increased risk of cancer, the only way for early diagnosis will be screening. And that actually happens in countries that have a high prevalence of gastric cancer. You know, I'm sure you've heard of in Japan, they will do endoscopy, or earlier down, they were doing gastrocamera on patients or people. I wouldn't say patients because they are not patients, people above the age of 40. And I think they have programs now in Taiwan as well as Korea. They look and screen for cancer, especially if you have risk factors. Of course, if you have H. pylori, you get rid of it. Now, I will show you a picture, and you're going to differentiate that. This is an image-enhanced endoscopy, which is actually a scope that is magnified, and you can look at pattern. So imagine you see this little white spot only in the stomach. You're not certain that this is cancer, but if you look at it in a magnified view with special staining, you can see that this is cancer. This is early cancer. I will show you the picture of an established cancer. Now, this is the difference. This is an established cancer. This is, even though small, is established cancer. Look at the one that you see here. This one, actually, you will pick it up. You don't even need to do surgery. You do what we call a resection by the scope of that whole area. And you are able to actually remove the cancer by removing this area without surgery. And the outcome of this patient, as I've said, in early cancer is very good. So before I end, this is what happens. If you want to screen for H. pylori infection, you have risk of infection, you screen it and you can treat it, you will reduce the risk of ulcers, you will reduce the risk of cancer. If you don't have a healthy lifestyle, is very good. Stop smoking if you are smoking heavily. Take more fruits and vegetables and less of preserved food and less of salted food. And also the other not so proven things will be exercise. It is proven for colon cancer, not so proven for stomach cancer, but it is good for health and it will improve your health and perhaps it will also reduce the risk of cancer. Thank you. Okay, I do have a question here which tends to be a little bit general by Abang William Tunggari. Apa yang menyebabkan kanker saluran pencernaan dan hati? I need to tell you that the system saluran is a very long system. Itu include the stomach, the colon, the whole of the small intestine. So I won't be able to tell you all the causes. I have told you about the causes of the stomach, okay, which is of course salted food, preserved food, H. pylori infection, chronic inflammation of the stomach. Okay, we will increase risk of cancer of the stomach. Now for the colon, again, the studies have shown red meat, excess is bad for the stomach, bad for the colon. Cigarette smoking is also bad. Fatness is bad. Fatty liver is bad for the as a risk of cancer of the colon, and of course, fresh fruits and vegetables as well as exercise reduce cancer of the colon. Now for the hearty, which is the liver, alcohol is bad. If you have chronic infection of the liver due to hepatitis B or C, that is considered an increased risk of cancer. This goes with a general concept that chronic inflammation, A chronic inflammation of the stomach leads to cancer. Chronic inflammation of the colon as well. If you have ulcerative colitis or Crohn's disease, which is a chronic inflammation of the colon, it also leads to colon cancer. Liver, if you have hepatitis as a result of chronic infection from hepatitis B and C, it leads to increased risk of cancer of the liver. Alcohol causes that. So any things or any conditions that leads to chronic inflammation of the liver, cirrhosis, will lead to increased risk of cancer of the liver. Now that we are talking about primary liver cancer. The secondary liver cancers are cancers that goes in the liver from other places, and then risk will depend on the risk of the primary cancer. Okay, I hope that satisfies you. We're not able to answer all of it because the whole system is very long. There are risks of cancer of smoking and drinking for cancer of the pancreas as well. So that's a slightly different risk of it. Now, someone asks, if you are constantly bloated 2 to 3 years, is it normal? It is not normal, but it may not be serious. So it depends. What do you mean by it constantly bloated? If you are constantly bloated and still every night go to eat char kway teow, or every night you go and drink alcohol, then this bloating means nothing to you, and therefore you can continue it. If the bloating is associated or with serious symptoms, for example, you are losing weight, you have nausea and you're vomiting, you're passing out black stools, and you cannot eat, all right, you cannot swallow, then of course that bloating becomes serious. But I would still suggest if you have 2-3 years of bloating, go and see your doctor. Let him go through your history, examine you, and see whether there's any need to do anything. Some of this bloating is due to the food that you take, the way that you eat, and as well as whether you are stressed and sensitive to your stomach sensation. Let me give you an example. If you take a lot of kacang, a lot of nuts, a lot of you may get bloated because a lot of nuts will produce that. If you eat very fast and you talk when you eat, you swallow a lot of air and you also get very bloated. That's why people who go to the pubs and drink beer, after that they feel very bloated, but of course they're very happy with that and they belch out the gas, and after that they feel very good. So bloatiness has a lot of reasons. Some people are sensitive. During the COVID times, we have a lot of patients who come and tell you they are bloated. Maybe they are very stressed. But this is something that goes on. But remember, if you are uncertain, seek your doctor. But let me tell you, if you have 2-3 years of bloating and you're still dancing, I won't be too worried. Okay, now there was a question here which says, which patient groups are at increased risk of getting cancer from H. pylori? Now, obviously, there are differences between sex. It's more common in a man than female. There are differences in racial groups and in geographical regions. For example, in the United States, it's the Hispanic and the blacks who have more gastric cancer than the whites. In Malaysia, let me give you an example. The H. pylori infection is highest in the Indians rather than the Chinese. Of course, Chinese are very high, but you don't find, or it is very rare to get stomach cancer in Indians, but it is something that you hear quite frequently in Chinese. H. pylori infection is quite low in Malays, and therefore stomach cancer is also not as common in Malays. Now, why is that so? Part of it is genetic, part of it is probably diet. The Chinese diet has salted food, preserved food, which is not good. It is also a cause of the cancer. Are there any things in the Indians as a race that protects it? Or maybe it is in the diet? We are not too certain. But definitely chilies is one of the factors that is important because studies have been done long ago that people who take chilies don't get ulcers. Very rare to get ulcers. They can get gastric. Remember, that's a difference. They can get gastric, or when you get gastric, you cannot take chilies because the chilies will upset people with gastric. But those that take chilies, they don't get ulcers. Maybe it's the chilies that protects the H. pylori infection in Indians from getting cancer of the stomach. A study done in the University Hospital by my colleague Professor Goh at that time also looked at and found that Indians have the highest prevalence of H. pylori infection, but ulcers are lower than the Chinese. Okay, so that has been shown actually in a lot of studies already. Now, are there any other things? Now, mine is a guess. I don't think it's been totally proven, but in laboratories, it has been shown that turmeric, or what we call the yellow ginger, I think, turmeric has very good properties, anti-cancer properties. And I'm sure the Indian food has much more of that than the Chinese food. So it may be that, but those are not proven or proven, I would say, statements. But it is something to work on, and there are a lot of research on turmeric in the laboratory as well as epidemiologically. Now, okay, there's a question here which seems to be not on the stomach cancer H. pylori. How long does hepatitis vaccination last? So I would assume that he's talking about hepatitis B, and I will talk about hepatitis A as well. Hepatitis C has no vaccine. Okay, hepatitis B vaccine, if you take the 3 doses, which is a standard regimen of hepatitis B vaccination, if you check for antibody, that means you check and you have produced antibody, the antibody lasts forever. Even if the level goes down to 0 or to a very low level, you are supposed to have memory cells in the body. So anything, if a virus goes into your body, your memory cells will produce antibodies and bring it up. If you want to, and you like to see numbers, big numbers, you can actually do a booster. When you give a booster, the antibody levels will go up at a very high level. But you must know that you have produced antibody, because vaccination does not equate immunity. And this is what's happening in COVID. They are doing trials. They want to know whether they produce antibodies. And when you produce antibodies, you want to know whether it protects. In hepatitis B, we know that it protects. But you can get a 3 courses of hepatitis B vaccination, and if you don't check for antibody, some people do not get antibody at all. And if you don't have antibody, obviously you are not immune to the infection. And that gives you the answer for hepatitis B. For hepatitis A, if you do 2 doses, usually within 6 months to 1 year, it is supposed to last for 10 years. It's supposed to last for 10 years, but hepatitis A is a new vaccine. It probably will be also protective for longer than that. But from the studies, it's supposed to last for 10 years. Hepatitis C at the moment has no vaccine. I hope that answers your questions. Okay, there's another. Can you get infected with H. pylori bacteria and nothing happens? And that's what I was trying to tell you. A lot of patients have H. pylori infection, do not know that they have infection, and they do not have any symptoms. Therefore, they do not get symptoms. But as long as you have H. pylori infection, you do have an increased risk of certain things occurring in the stomach. So I would think that the risk for cancer of the stomach is not reduced. It may be less than some other person who have a severe inflammation in the stomach, or who have changes that are irreversible. But we cannot say that a person who has H. pylori, although has no symptoms and no gastric problem, will not have a slight increased risk of cancer of the stomach. that we cannot be 100% sure. All right. Now, there are differences in the type of infection. There are certain virulence factors in the H. pylori itself, which makes the risk of gastric inflammation more and therefore increase the risk of cancer. Now that, of course, you will just look at the H. pylori, you won't know. You have to measure certain things. You have to know certain proteins or certain things like toxin that they produce. So certain with a bit more strains that are more toxigenic, they tend to produce more problem. Okay, so in answer, can you get infected with H. pylori and nothing happens? You can get infected H. pylori bacteria with no symptoms. You don't get ulcers. In a lot of them, 95% don't get cancers. So I suppose in that way, you can say nothing happens. All right, but you must remember the risk is not totally zero. Okay, Nicole asked whether after taking antibiotics for H. pylori, do you do checkup for that yearly? No. Now remember, I mentioned again, if you take antibiotics for H. pylori, there's no guarantee that you eradicate the bacteria. To confirm eradication, you are to repeat certain tests. The test I would recommend is a urea breath test, unless you want to do the scope again. And there's no need to do the scope again if you have not done. If you have a gastric ulcer, you want to see that it heals, you may repeat the scope again. And when you do the scope test, we always will check for H. pylori infection. Now, if you don't want to do the scope again, you do the urea breath test. And if you have the stool antigen test, you actually can do the stool antigen test. But don't do the blood test. The blood test is a test for antibody. It will remain there even if the bacteria is gone from the stomach. Now, some people I know, or even some doctors I know, continue to check it by blood test every year. And every year it becomes positive because it is supposed to be positive. But it does not mean that the infection is still there in the stomach. So you have to do other tests, not the blood test. So if that is important, you must do the other tests. And there are certain criteria. You do not do the urea breath test or even the scope test immediately after finishing the antibiotics. Because if you do that, it's not accurate. You have to leave 1 month. So you can do it later than 1 month, but you have to be at least 1 month after the eradication. And the other criteria is that you must not be taking any PPI or any acid reducing agents at that time. If you are still taking medicine, it can affect the test. And if you are taking antibiotic recently for any other reasons, even for 1 month, you cannot do the test because antibiotic may suppress it. So it may not be totally gone. It is suppressed because you're on antibiotics and therefore the test may not be accurate. I hope that answers you. A urea breath test is the one that you want to do a month after eradication, and you must not be on antibiotics, and usually you should not be on PPI for at least 2 weeks. Okay, there's a question here which is, can H. pylori be transmitted through food sharing? Well, it is an oral to oral route. So in principle, I would say yes. And in fact, in Australia, last time they did a study, they say chopsticks spread the infection. But it depends on the style of eating, really. If you have not a great style of eating, and you put a stock chip in your mouth and you swallow, you lick it with a saliva, and then you pick up the food and give it to your boyfriend or your husband, I'm sure that is possible. In Russia, when H. pylori was not discovered, was presented, they call it a kissing disease. You can spread by kissing. So obviously, you exchange saliva through kissing. Okay, that is possible. All right, so you can spread it through food if the food is contaminated. Now, if you have been to Hong Kong for the last few years, you will have a white chopstick and a black chopstick. The white chopstick is the one of the chopsticks go to the food in the center pool, you take it back to your little dish, and you use that chopsticks for you to push it into your mouth. So that part of it is not shared. And that is because they have experience with SARS, they also have experience with H. pylori infection. And that may be a better way of eating. So it is the food hygiene that is important, but to in a way to answer your question, yes, possible. Oh, the other question here, the next question is, when should you test for H. pylori? Now, I have mentioned about testing for H. pylori when you have treated or you have been found to have H. pylori. Is there a role for testing everybody? I don't think at the moment the society, our own gastro society, recommend nationwide testing in that sense. I think what we do is opportunistic testing. If you are the type or you have a family history of gastric cancer, you want to test whether they are increased risk, yes, you can test it at that time. Most people with gastric problem or indigestion problem will have that tested. When they go and see the doctor, they will have it tested anyway. So that will be the occasion where it is tested. All right. So, but there is no nationwide program to test everybody because Malaysia is not considered a high prevalence country for gastric cancer. But in other countries, like for example, Matsu Island in Taiwan, I think most people have already been tested and most people have been treated. So in a way that they have a program there, which is a public health program, which are also they are also doing some studies on it. So it is a program that will test most of the people. Otherwise, there is no program to test everybody. But now if you go to any of the laboratories, the laboratories, they offer you laboratory surveys, they will put the H. pylori test as one of the tests that is being done. Now, I am in no position to discuss that and see whether it is correct or not. It is again opportunity for people to have it tested, but it is not a national program that is mandated by the country itself. Okay, but I think that's a good test anyway. Okay, if there are no further questions, I would like to end the session. I hope you enjoy it, and perhaps we can discuss on other issues again if you wish to. Bye bye.